and I was directed to this area where they were doing endoscopy, and I had to kind of stand awkwardly outside of the door waiting for the staff to finish their colonoscopy and then be like, hey, it's me, you know, I'm Emily, it's my first day of residency.
Welcome to the Specialty Cafe, the podcast that empowers you, medical trainees, to find your perfect specialty. My name is Cameron Wong, and I'm a current fourth-year medical student at Queen's University. I'm here with Dr. Emily Wu, a current R2 at the University of Ottawa's Family Medicine program and a previous co-host of the Specialty Cafe. I'm hoping to chat with Emily about her experience with just starting residency in part of our CARMS mini-series.
Thanks for having me.
Yeah, thanks for coming on, Emily. I want to just start off with the first question of, what was your first day of residency like?
Yeah, it's a bit nebulous, honestly. I feel like there was a lot of stuff that happened since then. I think the first day, our program was really great in kind of transitioning us into residency. Although I was very stressed the first day. I think I actually started on July 2nd and not July 1st. And thankfully we had gotten, some orientation of the hospital beforehand. So I already knew where to go and I wasn't totally lost. And then I was with a staff who was really, really nice that day. We were doing admissions in the hospital. Mm-hmm. So the staff was able to, walk me through how to use the EMR, the computers, how to put in the orders. And I felt like seeing the patients was probably the easiest part of that day because I had, you already do that as a medical student. So that was sort of the same, but definitely, trying to find the room of the patient, making sure that I knew like who the nurses were, where the equipment and all this was, that was the most difficult part of that day. But like I said, thankfully, there were some really nice people to help me out. And I think at the beginning of July, everyone at the hospital, whether it's staff or the residents, nurses, they know that we're starting. So they're definitely more gentle and a lot more patient with you and very willing to help you out if ever you get a bit lost or you have some questions.
And another question that I'm really curious about is, what were just the logistics of you showing up on your first day? Did you get an email? Did you get summoned to a specific ward? Did you already get assigned a list of patients? What was it like?
Yeah. So like I said, thankfully we had some orientation, before starting. So I already knew a little bit where I was going. So I actually started in the family med clinic with my preceptor that we have for 2 years. And I had already met him beforehand. So I already knew who he was and kind of what to expect. So I went to the clinic and, like I said, seeing patients was probably the easiest part. It felt exactly like, a normal family med clinic that you would do in medical school, except now I could, prescribe things and print out stuff for people. So that was a little bit different. And then it was a bit stressful because I actually was starting in the afternoon. I had to go to the hospital, which is right next to the clinic, to do a GI rotation. And that part, I didn't know where the GI department was. Somebody was like, oh, you have to go to endoscopy, as if I knew what endoscopy was. So I kind of wandered around the hospital a little bit, asked some people, and I was directed to this area where they were doing endoscopy. And I had to kind of stand awkwardly outside of the door waiting for the staff to finish their colonoscopy and then be like, hey, it's me, I'm Emily, it's my first day of residency. That kind of awkward introduction that you do at the beginning of every rotation in medical school. But thankfully, they knew it was July, I think it was July 2nd when we started. So they knew that it was my first day and they knew that I was a little bit lost and a little bit confused. And they were very empathetic about that, kind of guiding me through on the next steps. Yeah.
Well, that's very nice.
Yeah.
Sounds like people were overall very supportive of the fact that it was your first day.
Yeah.
Maybe it had been a few months since you've had any patient contact at all. Many people go on vacation after they finish medical school in between med school and residency. What you're talking about sounds, I guess, familiar to me because I, as a fourth year, am coming off of visiting electives where every so often I'm going to a different school. And like you mentioned, I'm figuring out a new EMR. I'm figuring out Is the system in which like you make referrals to like different outpatient clinics different? How do you find a patient's room? How do you page someone? So many different things to consider for sure. And I think this sounds like it was a consideration for you, especially because you moved from your med school in McGill to attend residency in Ottawa. And that sounds like a situation like many other people experience, especially as they move from med schools to distant residency programs. And so as a related question, I guess, like, how was the move from Montreal to Ottawa?
Yeah, again, thankfully it's not super far, so I didn't have to go cross country. What was great is that I actually moved in with someone that I went to med school with who also started residency here. So I had that support already going in. But definitely it was a bit of a culture shock almost of being in a new hospital and being in another province. I think learning about, like you were saying, how to make referrals, just the intricacies of the system was definitely a big learning curve for me, especially family medicine. We rely a lot on community resources, so not being super familiar with the ones that were around the area was a bit challenging at first. Again, in terms of the hospital setting, I think it was probably the easiest part because it's pretty similar across the country. Exactly. Yeah. The patients are very similar, and I'm in the French stream of the Ottawa program, so it was also bilingual, like I was experiencing in Montreal, so that was very similar. But yeah, definitely having that support system of people that already knew here, and my residency, like my co-residents were also, a lot of them were like did move from other places to Ottawa, and they were new to the area as well. So it was very like good to have someone to bond with over the challenges that we were all facing together.
Yeah. And I recall you mentioned before to me that you did essentially all of your education in Quebec and like moved to Ottawa. So I was going to ask if you had the experience of speaking French with patients or if it was a conversion to like more of like English centered patient care. But I'm sure you get both, like especially when caring for patients.
Exactly. I think at our hospital it's about 50-50 of people who are Franco-Ontarians versus Anglophones. Definitely in the other Ottawa hospital, not the French one, it's a lot more Anglophone. What was great is that I was very worried about having to chart in French because at McGill we only chart in English, but thankfully we only chart in English as well. So that was great. I was very stressed about that. But yeah, it was pretty similar, I would say.
And like with the move from McGill or from Montreal to Ottawa, was there anything like you reflect on now and you think like, oh wow, like that was like, I guess like a lot to handle, like maybe you mentioned that you moved in with someone there, so you had that support, but I guess like finding out where's the nearest grocery store, how do I find parking, how do I figured all these things about like just living in a new place.
I think the hardest part was definitely my support system. I had some really good friends that I made in medical school, obviously, and a lot of them stayed in Montreal. So I was definitely a bit far from them. And I think also I didn't think about this, but as a resident, at least in family medicine, I felt like I was often by myself. Like in clinic, you're with your staff, you're not really with other residents. So I definitely miss, being on a rotation and being with my friend who was also, a medical student or a resident, a specialty, or just, coming across people in the hospital that I knew and like saying hi to them. So that was very challenging at the beginning. And reflecting on that, I wish I had maybe made a little bit more connections before starting in residency here. But now that I'm in my second year and everyone is very inviting in our program, I definitely feel that, I can be on a rotation with my friend, or I can say hi to people in the hallways. So that's definitely changed a lot throughout residency, and I'm really grateful for that.
Yeah, that kind of reminds me of how I felt like when I had finished my I guess like 6 weeks of internal medicine at Queen's, and I was like very familiar with like people on my team, people in the hospital, like so many familiar faces. And then like suddenly, whoa, like I'm in Vancouver, I don't know anyone, a little bit less familiar that way. So yeah, I definitely see like very understandable that it might have been daunting for sure to like be in a new hospital, and then you're expected to perform, you're expected to like know, I guess, what the system is like while being not super familiar with it. But yeah, a lot to handle for sure.
Yeah. And I think all the staff, you know, they knew that a lot of us were coming out from different medical schools or lived in different places. So as long as you, like, the patient care, the medical side of things was pretty at your level, like at an expected level, I think the other administrative stuff, they were very patient and, you know, they understood where we were coming from.
So I want to, I guess, like jump to a related topic of like advice you had about adjusting to residency and then like really like thriving, I guess, like from a personal standpoint. I understand like now at this point, like you're almost a staff actually, which is really crazy.
It is crazy. I don't want to think about it.
So having gone through your residency and having seen like kind of what worked for you, I'm kind of curious to like ask, like, were there any like really hidden tips and tricks for, I guess, like adjusting to like this new lifestyle that like might be different from med school? And I guess for context, like I remember getting a lot of advice in clerkship. I remember being told by like mentors, like, get compression stockings for the OR, get orthotics so you don't hurt your feet, and then like get a cooking nanny who you can buy like food off of from like Facebook Marketplace, and you can get home cooked meals that way, so you're not eating hospital food all the time, things like those. So yeah.
I mean, definitely the comfortable shoes. I totally agree with that. I don't have orthotics, but I wear sneaker, like running shoes, like very comfortable running shoes in the hospital. So that's key. And I love cooking. So I would never, it's not my style to like ask someone else to cook for me. But I have a lot of friends who do like pretty serious, like some of them are more serious than others, but like meal prepping on Sundays or Saturdays, they'll cook a huge batch of whatever, and they'll have meals for the entire week. And I think that's kind of what I do. I kind of cook a big meal every so often so that I have some lunches. Yeah, exactly. Because it can be quite hectic if you're on call, if you're like post call, if you have evening clinics or evening shifts. It can be difficult to, you know, cook as often, and then you end up, you know, eating hospital food, which is, you know, sometimes it's okay, sometimes it gets a little
depends
bit pricey.
On the hospital.
Yeah, it depends on the hospital. Definitely. But I mean, if you have like a partner or you're living with someone, it can be great to have that resource of like, oh, I can't cook tonight and I really need a lunch for tomorrow, so hopefully that can be solved. Some other lifestyle things, I mean, I think at the beginning of residency I neglected a lot of like physical activity and going outside and taking time for myself, so I started doing that a bit more. And that I feel has a really positive impact on just my mental health and, you know, feeling better at work in general and generally. And not being scared of like exploring where I was. You know, I found lots of great things to do here in Ottawa, and that has really brought me a lot of appreciation and definitely helped ease a bit of that stress that comes with work.
Yeah, I would say like very understandable that like in this like really difficult transition time when you were going from med school to residency, figuring out like a new city, like making new friends, making new colleagues as well. Like I guess like sometimes like I definitely imagine like maybe I would go to like the gym less, or like maybe like not cook for myself as often.
Yeah,
so
for sure.
Yeah, I'm glad that like as the time went on, like you were able to like I guess like reach out or like be more familiar with like routines and like the resources available in the city. So yeah, and
like freezer meals are great as well. If you freeze a big batch of soup or chili, I think I did that a lot in like Med 3 in clerkship. I had a lot of that. So yeah, you know, giving yourself a little bit of cushion, if you will. So if there are busier rotations, busier weeks, then you can lean on that.
Yeah, for sure. I really like talking about like, well, I guess like food, especially like with like work-life balance. It's become such a big like, I guess focus of mine after like at some point, like someone just mentioned, like it is the bottom like rung of Maslow's hierarchy, so you can't really do any of your other doctorly responsibilities if you're hungry all the time or
That's very true.
don't have enough nutrition. So yeah. I guess like we're kind of coming to the end of our conversation, unfortunately, but maybe one last question to kind of sum up what we talked about was like, what is like one piece of advice you'd give to med students, I guess like me in my 4th year, going on to hopefully becoming a resident on July 1st, to kind of like make a successful transition into residency?
I guess one thing that I would say is, being a bit kinder to yourself when you start that transition. I think a lot of medical students, they're obviously super excited to start residency and have that responsibility. And it'll happen that you're not sure what to do, or maybe you're not performing at the level that you kind of put pressure on yourself. I think we're all very perfectionist, high achieving people. So we put a lot of pressure on ourselves, but just be kind of like, this is the first time that you're being a resident. This is the first time that you're having the responsibility of prescribing, having your name, signing your name with a license. So recognize that this is really the first time that you're doing this job, and it's normal as anybody starting a new job that you're going to go through some challenges.
Yeah, first for a lot of different things.
Exactly.
Prescribing, being in like in a new hospital.
Exactly.
I guess like maybe like supervising med students as well, like recognizing like your ascending role in like the medical ladder as well. So
absolutely.
Yeah, lots of firsts for sure. But that is really, really sweet advice.
No worries.
I hope to keep it in mind when I hopefully become a resident on July 1st as well. But yeah, thanks so much, Emily, for chatting with me about your experience when you started residency. Learned a lot about like kind of your experience in moving to a new place and your tips with like making freezer meals and stuff. Yeah, something I haven't done in a while. So yeah, something I should get back on. But yeah, thanks again, everyone, for joining this episode of the Specialty Cafe podcast. And if you are a resident, a part of a Royal College affiliated specialty, remember that you can join the Royal College as a resident affiliate member for free. And you can find any of our episodes on the Specialty Cafe on any of your favorite podcast platforms. See you next time.